So I want to thank everybody for coming today. I want to start off by introducing myself. My name is Jeanette Deroy, and I'm the new I'm the new Regional SHINE Director of Bristol County. And SHINE, in case anyone doesn't really know, means serving the health insurance needs of everyone on Medicare. Not everyone in the world. And so people may wonder why they need SHINE. Why is SHINE important? How do we help? When you have Medicare, or if you're approaching Medicare, you're probably very overwhelmed with all the mailing that you're receiving. You probably see the prices of your insurance plans going up, prescription costs may not be covered, and you also see the TV ads all the time, and you're wondering, does that apply to me? I need that. And so there's all this conflicting information. And so SHINE is there, we as counselors are there to give free, unbiased, and clear explanation of all the plans that are available for you. When you come in, when you call us, we gather information from you as an individual so that we can look up the information that applies to you specifically and offer you the plans, whatever they may be, that are fits you, your needs medically and financially, so that you're getting the best, again, that's best for you, not something that's going to benefit us at all. So again, it is unbiased and free. And that's why SHINE is beneficial as opposed to the TV ads you see on TV, people who may knock on your door trying to sell you their particular insurance. This gives you all of the options that are out there. So what today's program is going to be about is what to know about open enrollment and what to avoid. That's very important. As I mentioned, during this time of year, where October 15th through December 7th, that's when open enrollment is. And this is in preparation for when the Part D plans and Advantage plans, or what you might know as Part D and Part C, they change their premiums and many times their prescription coverage. And so people need to be prepared for these changes. Open enrollment is the only time of year that the majority of Medicare recipients have that time or availability to make those changes. There are few exceptions, but generally speaking, between October 15th and December 7th, that's when you have the opportunity to make that change, and that's why you do not want to miss that time period. At this time of year in September, before I get there, I'm sorry, during this time of open enrollment, what you do have the opportunity of doing is changing or enrolling in a Part D plan, changing or enrolling into an Advantage plan, which incorporates your A and B, what is covered by A and B, and also a prescription plan and other bonuses, or disenrolling from an Advantage plan and going back to original Medicare and picking up a supplemental or Medigap plan and a prescription plan. So these are things that you can do during open enrollment. This is not generally the time that you would worry about a Medigap or supplement plan, making those changes, because in most cases, you can change those during the year. So we usually ask people if they're looking to change their Medigap or supplemental coverage to try to do that at another time of the year, because open enrollment October 15th through December 7th is a very busy time of year for SHINE representatives and for people like yourselves that may be wanting to change their coverage, and it's limited time, so we try to postpone the Medigap changes into other times of the year that if possible. But again, that can be done at any other time of year. So how do you prepare to make these changes during open enrollment? In September, many of you who are already enrolled in a plan, whether it's a Part D or an Advantage plan, should be receiving what is called an annual notice of change from your current insurance plan. in that letter or in that annual notice of change, it's going to go over any changes of premium and or drug coverage changes. So you want to look over that notice very carefully, and you might see that there's no changes to your plan and might be very happy with that. But if you do notice that there's going to be changes, you want to be prepared for that. The next thing you want to do is now shop for your plan. Now again, if you found that your current insurance plan was not changing at all, and sometimes that does happen, you might be on a plan that is not making any changes for the following year, you still may want to shop for the next year. And the reason for that is that there are many new and lower cost plans that may have richer benefits than what you currently have. And you may want to look at those options to see if you can get better benefits on your plan or a lower cost. And again, that's what SHINE counselors are there to help you with, to look at all of your options. So again, you want to shop for your plans. And in order to do that, you're going to get lots of mailing. During that time, you're probably already receiving them now. They're probably starting to come. You can look over that information. You're going to get people calling you. You're going to get people possibly even knocking on your door. Those are the things you want to avoid. And the TV ads. Please avoid the TV ads. What you're hearing on TV is a blanket statement that does not apply to everyone. So please avoid that. But when it comes to the phone calls and the people coming to your doors, they're well-minded. They do want to help you. But again, it's not to give you all of your options, but their specific plan, and maybe the best of their plans, but not all of your options. And so we ask that you be very careful of that as well. So to shop your options, your next step would be to call a SHINE counselor or a council of aging. And you want to do that as soon as possible prior to open enrollment if possible, again prior to October 15th. If you are just making revisions or changes to your Part D or prescription plan, when you call for an appointment at your local council of aging or with your SHINE counselor, they will ask you some questions and go over some of your information, but you may not actually physically need an appointment with them. What they may do, if it's just for Part D, is they may mail you out a simple form to complete and fill out with all of some basic information about yourself and also your prescriptions. And that way they can do a comparison search for you on the Medicare.gov site. And then after they've done that search, they would call you and specifically go over what your different options are, and then let you make the choice of what you feel is best, and then help you to enroll. If at that time you preferred to come in to speak to them further, we would do that. But again, that is something that can be done over the phone to complete the process, and most people do it that way for your Part D. For your Advantage plan, Part C, that's a little bit more complicated because there's a lot more involved with that. And so you can call, again, your local SHINE office and make an appointment with them. When you call, again, they will get some information from you and make an appointment. We ask that for that appointment, you bring your Medicare card, bring a list of your prescriptions, and your doctors. Now, your list of doctors may or may not be used by the counselor that you meet with, but still bring it to be prepared. At the time of your appointment, depending on which counselor's office that you call, they will tell you if there's any other further information that they want from you, and then you'll be prepared based on that counselor's office of that region. And again, to make that appointment or how you contact them, you can call your SHINE office that is local to you. You don't necessarily have to go far to do that. There's usually one in every city or town. So you can call your local Council of Aging to make that appointment. But remember, appointments fill fast during open enrollment between October 15th and December 7th. And SHINE offices will be very busy. So if you call them, leave a message with your name, phone number, and the town you live in, and be patient. They will call you back. But realize that they are busy. If you cannot reach them at your local Council of Aging, feel free to call us here at the regional office. Our number here is listed on the packet that I gave you, but it is 508-222-1399. Again, if you reach our answering machine, you can again leave us a message with your name, your phone number, and the town that you live in, and one of our counselors will call you back as soon as possible to make an appointment. Any questions? Yes?
Well, I have one because you said if you have a supplement plan, you didn't want us to make an appointment during that time because we could change other times. But what if we were thinking of going from the supplement plan to an advantage plan? Can you do that another time?
So supplement if you have like MedX or a secondary plan, during that time, yes, you can make that change. So you can make an appointment to make that change.
During that time period.
Yes.
Okay.
Yes.
If I'm not going to get on all this stuff until next May, I have to worry about it now?
Yes, if you're new to Medicare, now is not the time to, if you want to, actually ask your question again just so we can get the question on.
Oh.
Yeah, go ahead. Ask your question again.
If I'm not turning 65 till May, do I need to go through this stuff now?
Good question. So no, this is time is specifically for those already enrolled.
What if I'm already on Medicare, but I have a different, I'm also on Mass Health?
Mass Health is completely different enrollment or re-enrollment recertifications. If you have a Part D plan, now that this open enrollment is for you now. So what you do with Mass Health has their own time period, and what you do for open enrollment in Medicare is now, October 15th through December 7th. Mass Health, that's Mass Health. So that's what you do for Mass Health is their open enrollment. So you would still do that for them?
They're not going to accept me again.
We can talk about that afterward, but there's two different time periods.
Okay.
Sir?
2 questions.
Okay.
First question. The TV ads, you'll see them say that you pay 0 monthly fee, 0 deductible. We will reduce your Medicare costs per month. How true is that?
It's a very general statement that will not apply to most people. That will apply to very few people. So that's why you have to be careful of those commercials and feel like I'm going to go in and get that program. Few people that applies to, and will have that. And again, that's usually for low-income persons, and that's something we screen for everyone, but it's going to apply to very few people.
Another
Second question.
What is the advantage of actually having an advantage plan over a supplemental plan or vice versa?
So that's a good question. That is something that would be discussed while you're at your appointment or just prior to your appointment so that we can narrow down your choices. I'm not going to answer that question right now because we're focusing on the open enrollment, but it is something that would be answered and discussed at your time of appointment. Anyone else? I'm sorry, another one?
You might have actually answered this, but I'm not sure if you did or not. If you're on a supplemental plan now, which you can change at any time during the year. And after January 1st, if I wanted to change to an Advantage plan, can I do it at that time? Or does it have to be changed in the open enrollment?
Yeah, so that was asked. So if you were on a supplemental and wanted to change to an Advantage plan, it would be during this open enrollment, October 15th through December 7th, that you would make that change. Other times of the year, Medigap changes would be from Medigap to Medigap, same to same change. Did you have a question, sir?
I was going to ask, is SHINE publicly funded in any way, or do you completely private entity?
Oh, I'm going to wait for you to get the mic. So,
Sure. Is SHINE a publicly funded group, or are you a totally private entity?
most of our counselors are volunteers, actually. And then for a lot of our work that we do receive grants for that work. And so we have to work hard and prove why this is a necessary program for the public. And we do work hard to show the number of people that we benefit, how we're saving people money, how they're benefiting from the products that they're getting. So we do try to show what the benefit is, and the more we're able to show the benefit, the more grants we are towards the work we're doing, so we can do more for the public. Anyone else? Good question, though.
For someone who may work in the government for the city or the state, and they have insurance from that employer, should they look at during open enrollment? Should they change their plan?
That's a good question, too. Most persons who have insurance through the state or through the city have very, very good insurance. Secondly, most of those employees do not pay into Medicare during their employment. And so, depending on how long they've worked for the state or city, there's certain criteria for that. So they should first check with their employer to make sure that benefit, they have met the criteria for continuing that coverage at retirement, and they do not have to go into Medicare. And if so, they're very good. They do not have to continue forward with Medicare and Medicare products.
On the TV advertisements, you see a lot of the stars, whoever they are, saying, well, you can get X amount of dollars back on your Social Security. You're going to get all these extra benefits with a Medicare Advantage plan. Is there any criteria to get that money back?
Yes. So those are as we stated before, typically they tend to be available to those persons with lower income and many times lower assets. And they're very often assisted by Medicaid programs, again, which we screen for with each person that comes in. So those benefits do not apply to everyone, but to those who fit those other requirements. Anyone else? Sure.
So if I'm happy with everything I have and don't want to make any changes, I don't have to do anything.
If you're happy with the annual notice of change that you received, you don't have to do anything, but do review that sheet. But as I stated, you may want to still look at the options, because many plans do come out for the following year that may have lower costs than what you are on and more benefits. And so you may choose to change even though you're on a good plan. So it's worth searching if you have that opportunity. Ma'am?
Can you look at this stuff online?
Yes, anyone has the ability to go to Medicare.gov and do a search their own. If you can ask.
I'm just curious, because I pay by supplement, I pay extra for supplement, extra for prescription, but I take very little prescriptions. So I just would like to compare if I went through Medicare, their prescription plan, maybe it would be cheaper, in the long run.
I'm sorry, can you say that again? I missed the
I
end.
would like to check with like the Medicare program that has the prescription. I play an outside prescription, it's not part of Medicare.
It's not part of Medicare?
Because at the time when I did go and talk to the SHINE people, that seemed to be the cheapest.
Yeah, so you can definitely compare and do the searches yourself. Anyone can create an account on Medicare.gov. But again, because of the information, you may have questions, and we also might be able to answer some questions on credibility, whether or not you would receive a penalty for the plan you're on.
But I already pay for prescriptions.
There are.
I mean, I have a plan, I know they penalize you if you don't
Yeah.
get a plan, which I think is ridiculous.
So I don't know your plan specifically, but there is certain criteria that has to be met in order for there not to be a penalty. Just because you're on a prescription plan doesn't mean it meets all the criteria, so there's no penalty. And so those are things that we look at, we'll discuss with you, or we'll look at paperwork, we might request that, just to be sure that if you ever changed or went into a Part D plan or some other changes happened, that you weren't going to receive a penalty in the future. So those are things to look at and why a SHINE counselor may be advantageous for you. Anyone else? Oh, just one moment, I'm going to bring you a mic.
Can you change from the Medicare to the advanced plans or the Medicare? If you sign up for one, can you change, or is that a one-time thing? You can change from one to the other and then that's it, or could you bounce back and forth from year to year?
During open enrollment, you can change from original Medicare to an Advantage plan, or Advantage back to original Medicare, but only from the majority of people, only during open enrollment.
All right, because I had heard if you select the Medicare plan with the Medigap, you could only do it one time. So I was just wondering.
Nope. The Medigap, you can change at different times during the year for most people, and at certain times, certain criteria to meet that. But when it comes to changing from Medicare, the red, white, and blue card, and having a supplement or in Part D to Advantage, you can do that from year to year, as long as it's during open enrollment.
Okay, thank you.
You're welcome.
What is Medicare?
Medigap is another term for the supplement or secondary coverage to Medicare. All these different terms.
If I pick a plan and, say halfway through the year, the medication I'm taking, they're saying they're not going to cover anymore, what happens? Do I have any recourse? Can I switch plans at that point? What would I do?
There's different situations where that occurs. The first thing we usually suggest to a person that has a new medication that says it's not covered by your plan is to discuss that with your doctor. Many times a doctor can write a letter of medical necessity or get a prior authorization for that medication through the current insurance you're on, and that gets covered. There's other steps that are also taken that we could suggest, and we would do that at a SHINE appointment. And sometimes there's other, what we call special enrollment periods that we would consider at that time, if
Thank you.
necessary. Anyone? Sir?
I need roller skates.
I know you said that right now, with the open enrollment periods approaching, your counselors are going to be very busy You will be very busy with people looking to switch plans, but for me, I'm just looking to apply for the first time. Am I still available to, talk to a counselor at this time?
Yeah, so this is open enrollment for those specifically already on Medicare. But of course, there are still people during this time period who are new to Medicare during those months and have to make enrollments and need that information and education. So we're not going to ignore you if your open enrollment period is during that time. We're not going to make you have a penalty as well. So there are those who are new during October through December that we will take in and help.
Okay, good. Thank you.
You're welcome. Good question. Miss? You want to bring her a microphone?
So if you are new to Medicare, if it's the first time you're going on it, how much in advance should you start these conversations with a SHINE counselor?
Very good question. So if you're new to Medicare, the general rule is that 3 months before your date of birth, you can start the process by contacting Social Security to enroll in Part A and B, so you can get your card. And once you've received your Medicare card, then you can contact the SHINE office to help you with the other portions, the supplement, the Advantage, or the Part D. Those portions, the Medigap or the Advantage in Part D, any of those portions, we wouldn't need to actually enroll you or have an appointment until the month ahead of your effective date of Medicare. But if you called us 2 months ahead just to get more information and give yourselves time to mull over that information, because it is a lot of information, that is fine. It's appropriate to do. Questions? Oh, and to add on to that, although you have 3 months ahead of schedule before your date of birth or to enroll, Medicare does allow you up to 3 months after to enroll without a penalty, but we do not encourage that. The sooner you do it, the better.
If I'm turning 65, but I'm going to continue to work, what would that process be? Would I have to sign up for something, or can I wait?
For most that are continuing to work and have insurance through their own employer or through their spouse's employer, they can enroll in Part A, which is free for the majority of people, but they can postpone their Part B as long as they, again, have their insurance through their employer. They can postpone their Part B and Part D because they have credible coverage. Good question. Sir?
Just a follow-on to that question, because I'm probably in about the same situation where I've worked beyond my official retirement age. My wife and I have enrolled in Part A, so when it comes time we want to retire, we need to apply for Medicare. Do we get a certain amount of time after my official retirement date, or before maybe penalties are incurred or something like that?
Yes, you do. This is going to be an interesting answer. So for Part B, once you've retired and you are no longer on your employer's insurance, for Part B only, you have 8 months before you have to enroll in Part B. Again, that's not recommended because who wants to go without doctor coverage and outpatient coverage, and if you're, have medical needs, most people shouldn't go without that coverage. So we don't recommend going that 8 months, but some choose to, and you have that without penalty. But for Part D, your prescription coverage, you only have 63 days to go without your Part D. And that's often not told to you by anyone, unfortunately. So 63 days from the date of losing your last day of employer-sponsored insurance. So you want to get in touch with a SHINE counselor as quickly as possible for that part.
But you could extend that coverage after you retire through COBRA if you wanted to pay that extra amount. Would that count?
COBRA is a whole nother story, and no. Well, COBRA is credible coverage for your prescriptions, but not for your Part B. And it's very expensive, so most people don't choose to do that.
So it would cover that 63-day period for Part D, but not the 8 months for Part B. Okay.
All right.
Got it. Thank you.
So there's a lot of information in there and dates. It gets a little complicated. And yeah, you don't want to fool around with those dates too much. Anyone else? And again, if you forget those dates or get confused, you can call us again for the repeat. Okay, does anybody have any other questions? Well, you have our number in the packet. You know where we are. So if you have any other questions that come up or need our help, feel free to call us at any time or your local Council of Aging, and any of us are happy to help you. Thank you.
Thank you.